I am a doctor, not the kind of doctor that works on your insides, except for your deep insides. I mean the mind. I don't deal in gastroenterology, nor do I deal in proctology. No. What I deal in is far beyond those petty things. I deal in the mind, the inner workings of the psyche. I have extensively studied, and after my extensive studies, I have extensively practiced, and we're doing some very non-traditional psychotherapeutic videos here, and it's my idea, of course.
My mom agreed to this.
Not yet. Yeah, her mom did agree to it. I'm sorry. Okay, there's been a lot of, before any of the therapy goes on, which you're going to get to witness, because it's televised therapy now, on demand, for a brand new avant-garde audience of people that want to watch therapy happen. And you can get to learn how to do therapy yourself from it, but you have to have a degree, but you can get an idea of what it's like first, you know? And then we got a little... What's your name?
Courtney.
Courtney. We can give her some therapy, and it's going to be unusual, maybe, to a very traditionalist psychotherapist, but it's going to be some really unique therapy that's going to really get her mind off of the trivial and on to the beam. Let it commence. And all the documents have been signed. This is legal. Okay?
At least my mom said it was. I'm just
all
here.
All the documents have been signed. This is legal. Okay, my lawyer is great. Alright. His name is... it's Klein. It's Klein and Associates. Alright, just call... Alright, this is the beginning of therapy. And it might be awkward for you, Courtney, at first, because this is being filmed, I know. But just forget that this is a camera here. Let's do therapy like we normally do.
Okay.
Okay. Do you like my office today? Do you notice anything different about it?
It smells a little bit like rose candles.
That's right.
I'm not sure why you have rose petals on the ground.
Well, it's another story.
Or, a portrait of this really beautiful lady. But that's the only other different thing that I could, notice. I mean, you have your, pens and...
Okay. You know what the first thing I noticed is that you went straight for the olfactory. You became fixated on the nose aspects of the room as opposed to what, the normal first thing people go for when they're looking is looking. Right? They look first. The eyes are primary. Okay? So when I asked most of my patients, is there anything different about the room? Their eyes start darting around, searching for something, you know what I mean? And they see something, and maybe something that's already been there. Okay, and then I analyze it based on that. But you took a turn, did something I wasn't expecting at all. You started going straight for the smells. Does it smell like rose candles? You started mentioning visual stuff, but only secondarily to the olfactory, which means nose smells. Okay? Do you understand what that big word means?
Yes. Does that mean I'm really cool, though?
It means that you are manifestly, pathologically, neurotically, goddamn borderline.
Oh, so that's, good, right? That's good.
Borderline good. You have borderline personality disorder, and I've been trying to tell you this for a long time without actually saying it. But today I'm going to just come out and just be frank. because I feel like that may be a better approach psychotherapeutically at this point. It's a disease. Borderline personality disorder is recognized by several DSM books, and some of the symptoms include lack of ability to, like, no stable sense of identity. You don't get along with people good. You go back and forth. You're wishy-washy. You have issues. A lot of anger, a lot of jealousy, a lot of you have, like, you suffer. You don't like things that you used to like, or sometimes you just don't like things straight away, straight up, full stop. Don't like them, and you have a history of absolutely absurd behaviors, which is why your mother brought you in the first place, Courtney. And I spend a lot of time thinking about you, Courtney, when I am back at my apartment with wifey. And I think, this Courtney, she's a complex case. I have hundreds of people on my goddamn caseload. You know that, right?
No, but
This is Santa Monica.
I did know that I was really special, so
Special.
yeah.
Special.
I mean, those are
Yeah, you're special.
all my favorite traits, and
I do consider you a lot. That sounds special, right? So, Courtney, remember there's a camera now. I told you to stop, but now remember at this point, okay? Tell the camera what medicines you're on.
So right now,
I put you on them. Tell the camera which medicines I put you on and at what dose and at what time do you take them.
Well, I have Adderall,
How much? What dosage?
citalopram,
What dosage?
50 milligram extended release.
50 milligrams? Jesus Christ. 30.
It's not 50?
It's 33 times a day.
Well, no wonder I'm not getting as high as I thought I should have been. Anyways.
They don't make them in 50s. You're just dumb.
Not dumb.
I know how. I'm probably going to edit that part out. I'm just kidding. I'm being frank. But she's on Adderall, so she's a little bit. And she just started this regimen only like a year and a half ago, so she's a 17-year-old girl with borderline personality disorder, is on amphetamines all the time, a lot, that I prescribed her, so she's going to be a little bit testy. Alright? So even as a psychotherapist, I may or may not get really outraged by her behavior, which is delinquent. And I'm not going to lie, I get prescribed amphetamines too by my friend, buddy, psychotherapist, psychiatrist combo deal. And a lot of sedatives. More often than not, sedatives, but I have to stay up somehow.
You have friends?
What?
You have friends?
Yeah, we went to medical school together, and he's also a psychiatrist, does the same thing I do, except he prescribes me medicine. Psychiatrists can go to other psychiatrists and get pills. Not the only way they can get pills, but that's one way.
I mean, I guess I'm just surprised you have friends.
How'd you feel when I did that?
I don't know.
How old are you? Tell the audience.
17.
That's not true. Just kidding, it is. This girl's 17 years old. Her name's Courtney. I told you that. Her name's Courtney, but did I tell you her name? Did we say the age yet? Were you shocked when I kissed her? Well, you shouldn't be, because that's not taboo in a lot of cultures. It's just this very sick one that we're in. I am a very advanced practitioner. I go way beyond any of my goddamn competitors. I'm not going to let them just sit there and not break taboos. How is that going to help any psyches? Do you feel comfortable? You like it? Because I'm just trying to...
I just need... Is this helpful? Is this part of my therapy?
Everything that I do is part of your therapy, and I'm looking at it from an approach that is never going to be found again. Has never been found before. I've read
Oh.
all the big studies. I read all the studies. It means nothing to me at this point. You understand that? Like, I've gone beyond that.
Well, I
This is Santa
guess.
Monica, man.
I guess if, like, I really do have borderline personality disorder or whatever, and this is the best treatment, then I guess that, yeah, this is acceptable. I can, like, learn to fall in love with you or
What are you
something.
talking about? Falling in love? I was about to go to sleep. I
Uh,
said, how do you react when I kiss your cheek suddenly? I think you're not making good progress here. I'm sorry, man. I'm sorry. I'm not trying to make you feel bad about yourself. Okay? You're my favorite patient. Did you know that? And I think about you more than all the other patients.
really?
And I have over 300. Mm-hmm. Mm-hmm.
Really?
Would you let me kiss your cheek again? Courtney?
If it's good, yeah.
If it's good, what?
For my therapy.
Oh, yeah, I thought you meant if the kiss was good. But you wouldn't know until after I did it. So, but if that's what you meant, that makes sense.
But I haven't kissed anybody.
You've kissed me, right? I've kissed your cheek once, and it's gonna be twice soon. There you go. A little dry.
Yeah.
Sometimes you gotta learn that life is harsh. You think that kiss is gonna be romantic, it's really not. It's just two bodies coming together, and bodies are corrupt. Okay? It's defiled by nature. Have you ever thought about how quiet bodies are? How strange that is.
No.
Why don't you give me a regular kiss? You know what a regular kiss is like?
No. I mean,
Courtney, I know that you've been with other boys. Other boys.
you're not supposed to tell my mom that, though.
She's not watching right now, man. Courtney, kiss me. That's pretty good. How does that make you feel?
The same.
The same as what?
When I came here.
You're really borderline. She's 17. And she's fucking borderline. Like the Madonna song. Only worse.
But you tell me that I'm really special.
You are special. I mean, come on now. We're at Santa Monica here. You know this. It's as if I'm in love with your pinky finger. How does that make you feel?
I guess kind of special.
I mean, what do you want people to do to your pinky finger?
Well, I don't know. How should I know?
What kind of music do you listen to? What kind of music do you listen to when you're home alone?
I really like Justin Bieber.
Justin Bieber.
He's really popular right now.
You ever heard of Ian Watkins?
No.
Ever heard of the band Lost Prophets?
No.
Pretty good. Lost Prophets is definitely.
Is this required? I have to
It's required
listen to
listening.
them?
Yeah, Lost Prophets was one of the greatest groups of all time. Probably only rivaled by like Bad Company.
Yeah, Bad Company. What?
The band Bad Company. They're like probably. She's on a lot of. I put her on. Okay. Let me get straight about the medicines. I put her on some. Put her on. What was it? I actually put her on Haldol recently. I know that's not commonly used anymore, but obviously it's not intramuscular because I don't have. I mean, we did give her one intramuscular dosage when I thought she was a little psychotic. But she's on Haldol, and that's like, as far as I know, she's not showing any signs of tardive dyskinesia, so we're good. And I also put her on a couple other sedating things. She's on propranolol for her nerves. She's also on Xanax for her nerves. She's on Valium for her nerves. She's on temazepam for sleep. She's on Ambien for sleep. She's also on gabapentin for her nerves, literally her nerves.
And my nerves
And she's on
have been
trazodone.
doing so much better.
Yep. But then, I want to keep her up, so I put her on a lot of amphetamines. Not a lot. I mean, not enough to really kill you.
But it's kind of like now, like with
It's Santa Monica.
the amphetamines, I just keep grinding and licking my lips.
I know. She does do that a lot. It's a common side effect, baby doll. And you get used to it. Just keep taking them. You know what? I'm gonna add some amphetamines because you're real sleepy. And I'm gonna add one called desloxin. All right?
Am I not doing well today?
Yeah, you're all right. I'm gonna add one called desloxin. Listen to me.
Okay.
Desloxin is the best amphetamine there is. It's 5 milligrams. No, you're gonna think meth like Breaking Bad. No, it's better than that. 5 milligrams. Only 5 milligrams. It's a little baby amount. It's nothing. 5 milligrams methamphetamine hydrochloride tablets. It's gonna be hard to find. Your mother's gonna have to assist you in searching for it. Probably go to every pharmacy in town looking for it. Maybe even have to go to the city. But you're gonna come back with them, right? To show me that you have them.
Yeah.
I'm gonna prescribe you the highest legal amount I can do legally, which is 30 milligrams, unfortunately. I wish it was like way more than that, but 30 milligrams a day. But you're going to come back with a bottle once you get it. You're going to make your mother get it, and you're going to bring it back to my office as ASAP, okay?
Okay.
And it's going to help keep you awake, but I want to tell you more about it, but only after you bring the bottle back into me. Does that make sense?
Yeah.
Can you follow those directions?
Yeah.
Now, is there anything you'd like to say to the people that are watching this goddamn really brilliant project I have here?
I just feel good. I'm like special.
Say something more. That's enough.
What should I say?
What should you say? Goddamn, dude. I'm going to tell the audience, anyone that's watching, one thing. My approach to psychotherapy is deliberately aggressive. It deliberately defies taboos. If you are offended by any of this, then you need to look at yourself. You got a shadow side you're not exploring. You know what I mean? Like, what did you do?
That's what you did.
See? She's borderline as hell. God, I'm another confused teenage girl in my office. But that's just a technique I use to get into them, into their psyches. What I just did. Well, that seems a little callous. I know. I think. But it's just to get into their psyches so that I can really do medicine in there and make the paint work better. Now, do your real speech to the audience to make me so they know how good I am at what I do, and how much better you are. Because you're doing better.
Well, I will say I've been doing much better because he's been really helpful in helping me be more comfortable with my body and socially engaging with one another. So that's been like kind of helpful. And
I give you permission to continue.
And I kind of like kisses now.
And she only kisses, which shows that she's growing. Big time Santa Monica style.
So I think I'm doing good.
I think she's doing good. Wouldn't you say? I'm like right outside it. If you hear that traffic, I'm right. There's so much traffic coming by my office all the time. Goodbye. This is my first one. Goodbye. Courtney. I apologize for that traffic once again. Coming to the office. I'm sorry, I gotta plug myself real quick. It's 1524 Edmund Burke Commons. And I am Dr. Toby Lunch. And that's Lunch. Just like the meal in the middle of the day. Toby Lunch. And don't forget to bring, you could be any age. So, come prepared. Avant-garde. Psychotherapy. Alright, end of video. I mean, this is the first one I've done, so don't criticize how long it went on.